Our patient is 38 years old with symptomatic multinodular uterine fibroids. This surgery, uterine artery embolization, is considered to be a radical intervention. There are several options of traditional surgeries of uterine fibroids. The most common surgery that accepted all over the world is hysterectomy, that is removal of the uterus, and myomectomy, removal of fibroids. But in this case, the position of fibroids is such that during the surgery may occur complications, and the surgery may end with the removal of the uterus. As the patient has no children yet, she preferred this intervention, which is not inferior to the first two in the terms of effectiveness. The surgery is carried out under local anesthesia, and now we must anesthetize the inguinal area for catheterization of the femoral arteries. We do a puncture of femoral artery, after which insert the catheter and enter into the arterial system. The essence of intervention is that the blood supply of fibroids is ceased and they decrease in volume during months and turn into connective tissue, and the grapes dry out and turn into raisins. This catheter that you see is indicated for insertion into the left uterine artery and called Candra's uterine catheter, which is created for bilateral approach. It is already 20 years as this endovascular surgery is carried out in developed countries. In the USA, this method has been used since 1996, and in Russia it is included into a list of intravascular surgeries. Under the angiographic control, we find the uterine artery, which has a spiral shape by which we recognize this artery. And now, as you can see, we entered into the left uterine artery and should carry out a selective angiography of the left uterine artery. This is the left uterine artery. If you look closely, you will see that there is a copious blood supply in that area. We see a contrasting of this part. This copious blood supply occurs at fibroids, and the artery is called the radical artery. Now we'll carry out artery embolization, cessation of blood flow with the help of different solutions clothing the vessel, which will then lead to a significant disease in the size of fibroids. For this intervention, we choose a solution from embosphere, which are the balls of different diameters. In this case, we use the balls sized 500 to 700 microns. Their size we choose according to the uterine artery and its branches diameters. We introduce the embolizing solution into the left uterine artery. It is necessary to perform this procedure under the X-ray control so that avoid solution backflow, which may flow to the arteries of different organs and cause undesirable results. This is called anterograde embolization. On a recorded image, we can see a decrease in capillary network of fibroids, which indicates a certain level of embolization. At first, we notice that network is very large. After procedure, we notice a significant decrease in the network. Look how it has decreased. We should wait a little, as it will take several minutes to evaluate a stable final results. Do not lose the time, we continue procedure, and with a catheter we enter into the right uterine artery. Since the internal femoral artery has quite a few branches, in some cases the process of selective catheterization of uterine artery might become more difficult, but it's just a matter of time. Current angiographic tools allow to find arteries in any location. Now we are in the right uterine artery and carry out a selective angiography. On the right side, there is also a pronounced network of capillaries. Such type of network is peculiar only to the uterus with myomatous nodes. From the right side, the vascular network is more pronounced, and we use an embolization solution with balls of larger diameter to achieve a better result. Here is a cervical node which has disappeared. With the help of angiography, we can clearly see part of the nodes. In the last image, there is already no expressed node that was seen in the first image. The advantage of the method is that through a small hole on the leg, it is possible to enter both into the right and the left arteries. We returned to the left uterine artery because for evaluation of the final result, it is very important to wait certain period of time after procedure. Now you see repeating of the left uterine artery angiography. If you look closely, you will see that only the branches of the arteries are visible without capillary network, and this can be considered the final result. But to get a stable result, we will work a little more in this artery to avoid recurrent disease. On this monitor, we see the left uterine artery after embolization, but on these, branches of the left uterine artery before embolization. On this left array, you can notice subserious myomatous node, which is due to intensive blood supply was contrasted. In general, all branches of the uterine artery are very well developed. The myomatous nodes receive rather good blood supply. After embolization, it should not be noticeable at all. It should be like this image, which can be evaluated as successful result of embolization. Exactly the same, the right uterine artery should look at the end of the procedure. Here you see the first basic angiography. The right uterine artery and its branches are quite pronounced and arterial network very peculiar to the uterus fibroids. The final result is that the network, which is visible on the first image, will disappear. The results are also evaluated after several months after procedure, and during the first 6 months, it registered a decrease of the fibroids sizes by about 70%. They are replaced by a connective tissue which does not have the symptoms of fibroids. Though myomatous nodes can't disappear, they decrease in size by about 70%.